Mr. Goss.
Here.
Mr. Henderson.
Here.
Mr. Mills.
Here.
Mr. Moon.
Here.
Reverend Grant.
Here.
Appreciate all the board members being back. It's been a while since we've all been together. Mr. Randy's been out, Mr. Dawes, he's back, but we can stay 15. So we appreciate having him back. Mr. Superintendent, Mr. Dean,
Yes, sir.
let's stay in case you play. And most gracious, loving Heavenly Father, we thank you that we have an opportunity to come here and do the business of the students of this County. Give us courage, wisdom, and understanding to do what's best for everyone that we can. Be with those that are out today or ill, that they will be healed and brought back with us. Guide us and protect us. In thy name we pray. Amen. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Do we have any additions to the agenda? Do I have a motion to approve the agenda as printed?
I'll make that motion. I'll second.
No second. Any discussion? Roll call.
Mr. Burton.
Aye.
Ms. Craft. Mr. Goss.
Aye.
Mr. Henderson.
Aye.
Mr. Mills.
Aye.
Mr. Moon.
Aye.
Reverend Grant.
Aye. Mr. Superintendent, I'll turn it over to you.
Yes, sir. Mr. Burton, school board members, and those in the audience this evening, I provide information regarding our return to school. The information I want to share with you regarding some things that are related to numbers of students in the first couple of slides. Then I'll share with you information that was received from the health department with the group that they provided to their Virginia Department of Health and provided to the local health departments, and our health department director provided to superintendents. So the first couple of slides, we'll talk about where we are this year as far as enrollment. The slide's small, so I'm going to explain what we have here. This is what we do every year. Our schools provide enrollment data to our instructional department, and they compile a list for me regarding the numbers of students that we have that have actually enrolled in school. We call it E1, the E1. So right now, on day 3, we have enrolled 7,903 students. And that's that first arrow to the left there, kind of diagonal arrow down. If you look at the second arrow, negative 391, that's the difference in day 1 or day 3 this year to day 3 last year. So we're down 391 students from last year. And then if you look at 2019, again, that's the total number that day. Day 3 last year was 8294. So those are the figures that I have featured for you there. What that means for us is those numbers are used to determine ADM, average daily membership. That day begins September 30th and runs through March 31st. And we'll do an average daily membership, and that determines the amount of funding that we receive from the state for basic aid. The next slide provides for you. We built our budget, our 2021 budget, on a figure of 8,197 students. If we take day 3 membership, 7,903, the difference there is 294 students. I have this slide in here because these are the number of kindergarten students who have not completed physicals. So we cannot enroll a student, even if they're working virtually or remotely, unless they have a physical. So we have 52 students that can possibly add to the count. Well, right now, as of August 26th, we do not have those students' physicals. So based on right now, budget impact as of day 3, using the figure of 7,903 students, state revenues will come in below budget by about $2 million, 1.99 million. The General Assembly last week provided for us sales tax allocations, and those have been decreased for the county for this fiscal year of $357,000. It's about that same amount in 2022. So right now, we're looking at the possibility of a loss in funding of $2.35 million. If you remember in last month's meeting, we indicated that we received some stimulus money. Right now, the stimulus money has been set aside to make up that difference to keep people whole, our staff members whole right now. We have also spoken with our legislators about the possibility of using ADM, last year's ADM, as the figure for this year to determine budget, state budget dollars based on last year's ADM. The General Assembly is meeting at this time, and we are waiting for their decision there, Mr. Bird. Any questions regarding budget and numbers? Okay. My next slide. I'd like to remind board members that the governor's order that was issued last spring indicated that child care was an essential function. And I wanted to remind you all that we are allowing our teachers to bring their children, their school-aged children to school during school hours as long as it does not affect their instruction, their work hours. That is permitted so that they can work and they do not have to stay out to care for their children. But we need staff members in our schools to teach children. Any questions regarding that? We made that decision pretty early in July. I hope I've relayed that message to you, but I want to be sure that you all were aware of that, should you have questions. This is now going to start on the health guidance from the Virginia Department of Health regarding starting school this school year with COVID-19 as that factor that we must consider. What the VDH would like for locales to do is to base that decision on the closest level to students, and that would be local school boards. But they have created a dashboard that we will look at tonight that provides data, and that's data from this area, Pennsylvania County, as well as they provide the regional data too that we'll talk about, and state data. But I don't have much state data that I'll share, but I will share some regional data with you this evening. Their interim guidance for schools looks at 4 or 5 different areas. It looks at the COVID-19 case incidence rate and whether or not that's increasing or decreasing. And if you recall, I shared this with you the last meeting, so I'm just kind of going over the same things that I talked about last meeting. The next area that they look at the rate of COVID-19 outbreaks and whether or not that's increasing or decreasing. The dashboard also examines the rate of current confirmed COVID-19 ICU hospitalizations and whether or not that's increasing or decreasing. It looks at the PCR, and that's that test, that nasal test, the percent positivity for COVID-19, and whether or not that's increasing or decreasing. And then they look at how all this affects the healthcare community and their capacity to provide care to patients. They look at all this, they put into a statistical analysis, and they provide a composite score. And it's either a none, low, moderate, or high. And they look at trend and whether or not that's increasing, steady, or decreasing. And a term that Dr. Spillman mentioned to me today was fluctuating. And we'll talk about that as we look at our data. And then it says these scores are used to determine whether the region is again experiencing a minimal, moderate, or substantial level of community transmission. This is regional data. If you're green, there's no rate of transmission. If you're yellow, it's low. Orange is moderate, and red is substantial. And if you look, we are the near southeast or southwest region. So the first table to the left is the one that I shared with you all the last time we met. And we had the arrow, the red arrow said that we were trending upward. This is for the region. If you look at the second table, that's the most recent data that I have based on August the 15th. And again, the near southwest region is still orange, and the arrow has changed. There's no red trending upward arrow. These are the tables here. Kind of breaks it down, tables, and I'll kind of go through that with you. Again, it's the same data. There's the August 8th data to your left and the August 15th data to your right. If you look down to the fourth row, that's the near southwest row. And if you remember 2 weeks ago when we met, the burden was orange, moderate for the region. The trend was increasing, that was an upward arrow, and the transmission extent was increasing as well. That was the upward red arrow there. If you look at the region based on August the 15th data, we go down to that fourth row. That's the near southwest region. The first column there, the burden, is orange, moderate. There's a gray dot, which means it's fluctuating there for trend. And the transmission extent is moderate for the region. The next map shows the state of Virginia. And you can find Pennsylvania County at the bottom of it. We are red based on August the 8th data. We are red based on August the 19th data, which means substantial for this county. And this is the most recent data. This is August the 26th data that was shared with us yesterday. By locality, Pennsylvania County is still substantial in the red. These metrics here are metrics for Pennsylvania County. And if you go to the far left, that is data. 2 weeks ago, data that I shared with you all. And I'll go down what each row is. The first row is burden. The second rate is percent positivity. The third is outbreaks. And the fourth row is healthcare workers and how they've been affected. If you remember 2 weeks ago, the burden, we were 22.3, and the thresholds were 5 and 10, so we were well above the 10. For percent positivity, we were at 15.8, and the threshold was 10. And this is the percent of people who are tested that test positive for COVID-19. For outbreaks, we were very low, but we were fluctuating there, so we led with a +4, so we kind of shifted up to moderate then. And then healthcare workers, we were 2.1%, and the threshold there is 5%, so we're well below the threshold for healthcare workers. So in 2 of the 4 areas looked at, we scored a red, which would be substantial, and 2 we were low. 2 areas we were low. Last week's data, we trended down last week. Our burden decreased from 22.3 to 16.9. Our percent positivity trended down from 15.8 to 13.3. Our outbreaks remained steady at 0. And our healthcare workers decreased slightly to 1.9%. The next information, these 2 charts compare the first week that we shared 2 weeks ago with the most recent data that we received yesterday. And 2 weeks ago, our cases or our burden was 16.9. I'm sorry, I want to be sure I clarify. This is comparing last week with this week. Last week with this week. Last week was 16.9. This week we trended back up to 21.1 on burden. For percent positivity, last week we were 13.3. This week we trended up to 15.0. Our outbreaks remain the same, but our healthcare, the percentage of healthcare workers, that figure is the percent of people who test positive who were healthcare workers. And now that's at 6.9%, so we're above the threshold of 5% for healthcare workers. So now we've trended upwards to having 5 substantial and 1 low. So I've kind of broken this out and provided a bar chart for each of those different data that we've just looked at over the 3 weeks. So if we're looking at burden, our burden has shifted down from week 1. But last week was much better than this week. Our PCR positivity is trending down, but last week was much better than this week. Our outbreaks are fine. But our percent of cases among healthcare workers has trended up. In speaking with Dr. Spillman today, he indicated that we're at a point now we're fluctuating, which means that indications can be there. And I want to be very careful. You want to be very careful on how each year can be there that we're going to we'll be changing the trajectory down. So from that, he spoke like that, looking at bringing children back in. We can surely consider that as a board to do that. But you had the data been where it was last week, we would be in a much more favorable position today to say that than we are right now. But in that the indicators are fluctuating, he feels very good about that. I want to kind of go back because we talked about the last time that the health department has provided this dashboard for us to look at data. The Department of Education has provided the overlay of the governor's order and how we can correlate or provide a crosswalk between the 2 different data. This is more the requirements that we do versus specific hard data. So if your community is experiencing low community transmission, then you can relate this to a phase 3 opening. In phase 3, in-person instruction can take place, but you have to be sure that you're physical distancing and we're wearing masks. And that's kind of the bottom line there. And then there's some things regarding large gatherings. Moderate transmission rates can be associated with phase 2. And there you prioritize in-person instruction for the most vulnerable students first. You provide necessary services to vulnerable populations. You consider remote learning options for older students and remote learning options for those who are at high risk. So we can bring in our younger children. You can bring in your older children under phase 2 as long as you practice social distancing. And we have to practice social distancing for our younger students as well. When a division is seeing substantial community transmission, then a school board, the school division, should look at between phase 1 and phase 2 guidance for Virginia schools. Should look at possibly limiting in-person instruction for the most vulnerable students, provide necessary services to vulnerable populations, And this could be children who grades pre-K through 3, students with disabilities, or English learners. Consider remote learning options for older children. Remote learning options for high-risk students. And then as you move down, which is where you're moving more into substantial more to phase 1, remote learning should be considered as a primary method for all children. Any questions regarding any of those? Yes, ma'am.
Where we are, had August 26th, you say still in a substantial.
Still in the substantial as of August 26th.
We were substantial, but we were fluctuating. And speaking with Health Department, we get clarification there. We're somewhere between phase 1 and phase 2, is what he was saying. So he's indicating that is that we can come back as long as we mitigate, but the longer we wait could allow for, and again, I'm a layperson speaking in medical terms, could allow for the transmission to die down a little bit more, as opposed to bringing students back in and having to deal with that right now. So he said that as a board, you can consider having children come in, using mitigating strategies that we have in place, starting with your younger children and phasing in older kids, older students at a later time, as long as we socially distance and we wear masks and we follow with all the strategies that we have in place. All right, this is kind of a synopsis of what we've gone through. Just go through phase 1. If we're phase 1, our special kids can come in. You can bring special education children in who really need services. Child care has always been a priority for the government. That's an essential function that the governor has said should be in every phase. Phase 2, special education students. Child care is a priority there. Preschool through grade 3 students, English learners, and also summer camps, where in the summer, with your phase 2, that can take place. And then phase 3, all students may receive in-person instruction, as can be accommodated with strict physical distancing in place, which may require alternative schedules that blend in-person and remote learning for some students. And then beyond phase 3 to be determined at a later date. Not girl. Okay, so this is what we have. Based upon my conversations with the health department and reviewing the data, that right now the burden is high. The PCR positivity rate is high. The cases among healthcare workers is high. And we're substantial based upon what the data show. But we're in a fluctuating phase right now, which means that the data is turning and that comfort would be there to bring children back at some point in the near future. As long as we, and again, the health department has reviewed our health plan, and they reviewed our return to school plan, and they feel very comfortable with what the strategies that we have in place, where we've marked our classrooms with desks, we have our buses, students will receive every other seat on the bus, students will wear masks, they'll be socially distanced in the hallway, they feel comfortable with that. He believes that providing a week more would be helpful. So from that, my recommendation is this tonight, based upon my conversation again with the health department, looking at the data. We need to continue remote learning for all students through September the 11th. That is a Friday, Labor Day week Friday. You all have a board meeting on September the 8th. Review health department data related to COVID-19 weekly to assess community spread. We'll meet with Dr. Spillman, Director of the Pennsylvania Dental Health District, weekly regarding community spread of COVID-19. Bring pre-K and grade 3 students in on Monday, September the 14th. Follow our 4-day week schedule. It'll be a Monday, Tuesday, Wednesday remote learning for all. Thursday, Friday, students will be in. Remember that they are smaller groups in classrooms. They are socially distancing classrooms. 22 students on a school bus. We have processes in place where they would not be close together during the school day. And then to bring grades 4 through 12 students in on Monday, September the 21st, following an AB, and Wednesday, work remotely day, and an AD schedule. Mr. Burke, that completes my presentation this evening.
Any questions about the presentation? We need a motion and a second so we can discuss the recommendation.
I'll make a motion.
Move to get a second. Bill has a second. Now, any discussion about the presentation and the recommendation?
Mr. Chairman, if I may, I would like to, we have a microphone. I personally am. We didn't quite get it on the. Oh, okay. I am hearing from teachers, principals, parents. I think on my cell phone I've got over 40 texts that came in since Monday of this week. I've been in contact with some principals who have said, we are not ready. One of the principals went on to tell me that her teachers are scared. They do not feel that they're ready to come back to school. And we're only talking about 2 weeks, September the 11th, 2 weeks from now. I have a feeling that the last week or so, the reason we're spiking up again is because perhaps people are going back to school, colleges are opening up and closing as we speak. People are not self-disciplining, doing what they're supposed to do. So the spike, to me, continues to go up. I know in Gretna alone, the Central Health Department up there has had over 200 cases of COVID within the past 30 days. We're going into the Labor Day weekend where people are going to go on vacation. They're going to go to the beach. They're going to do all the things that they normally do. They're playing sports. They're playing softball. They're playing baseball. They're not taking into effect the social distancing that we would like to see them take. I'm just fearful that the cases are going to spike even more after September the 14th or the 13th or whatever, Labor Day, simply because it's going to take 2 or 3 days for these people who have been to the beaches and on vacation, etc., to be exposed and come back and spread the virus to other folks. If there was anything that I would like to say, there's a no-win situation for us regardless of which way we go. We're not going to make everybody happy. We're not, half of the parents are going to be sad, half of them are going to be happy. The texts that I have, 50% say, I want my kid back in school. My kid needs to socialize with folks. My kid needs face-to-face contact with the teachers. And I understand that, and I appreciate that. But as far as I'm concerned, there are 3 aspects to me when we address this. Number 1 is safety. Number 3 is safety. And number 2 is safety in between. We cannot afford to be not 100% safe in what we try to do. And I feel like that September the 11th, September the 12th, 13th, 14th, whatever, is too early. My recommendation would be that we do like some of the other localities and wait for 6 weeks. I know that doesn't sit well with a lot of folks, but from everybody that I've talked to, and I have talked to a lot of people this week, lots of people, especially the administrators, the principals, and the teachers, simply saying, you can say what you want to, but we are not ready. And we are scared to open up our schools that early. We would request 6 weeks. So with that, I hope you'll consider that. Safety, safety, safety. I just feel like that after Labor Day, we're going to see a spike in cases. We may even take it on into the late fall. I don't really know. But I just think that coming back to school right now is not the right thing, and we should delay it as long as possible. And my suggestion is 6 weeks. Thank you.
Is this on? I'm probably the only one sitting at this table right here that's actually remotely teaching a child in their house every day. I don't think anybody else is ready to go. Anybody? I think I'm the only one. And I can tell you from a grandparent's perspective, I want them in the building yesterday because this remote learning is extremely difficult. It's difficult for the teachers, it's difficult for the students, and it's really difficult for us older people that just aren't real good with computers. But in saying that, my concern right now is I know we're having issues already with just the teachers being back in the building, correct? So we're now having people to go out in quarantine, want to go out positive, not a lot, but I know we've had some, but when one comes in with it, they around others, and then we put 10 or 8 or 10 out in quarantine. My concern is we're going to open up, which I really want to do, get the children back into class, and we go down 2 weeks down the road, and we don't have enough teachers to have staff in the buildings, and then what are we going to do? We're going to shut buildings down, shut whole schools down. I want us to do it right. I want us to be careful. I want the students back in the room with the teachers. The teachers want them back. But I'm really concerned at where we at right now. Y'all see the numbers. They trending high. They have been for the last 3 or 4 weeks. I look at the numbers daily. I watch the numbers around through the zip codes. You can go on the website, watch them in zip codes, and the numbers are just trending high right now for the county. When is that gonna settle down? I don't know. I wish I did. But my concern is we get students in, and the next thing you know, we got a bunch out in quarantine or a bunch of teachers out. We can't staff the buildings. It's a lot more to take into consideration. I mean, you've got cafeteria workers that have to be there when the kids are there. You know, the bus drivers now get involved. There's a whole lot to consider in this, and we're already still in the red in most of those categories you looked at. You know, I don't know that we'll be the 14th the day to come back. I don't know. I think right now, with that much red, it really scares me to come back in the building. As much as I want the students in the building, as much as the teachers want them in the building. I will say one thing, the teachers have been absolutely wonderful. We have a middle school that we have at our house every day. The teachers have been great, the administrations have been great. Every time we've had an issue or call, they've been Johnny on the spot. The teachers are stressed trying to do it this way. The kids are stressed trying to do it this way. Like Mr. Henderson, my phone has lit up too. But I have to live with a teacher in my house, and that's even important. My wife trying to get through this. So I want to build as quick as possible, but I am scared where we at right now. And I'm scared that we're not going to be able to staff where we at. Okay, thank you.
Anyone else?
I think what Mr. Henderson said is important, that it's gonna be on all of us and all of the community to do what we can do as individuals to help to slow the spread and get our numbers where they need to be. That's all of us. I've had calls and contacts with families, some who want their students in the building and some who don't. But I think as we approach the holiday weekend, I'm sending out a plea to our community to be mindful of what you're doing and try as best as you can to follow the guidelines that have been put in place for us to get our numbers where they need to be. We do want our kids back in school, but we need your help to do that. And it doesn't take just one of us. It takes all of us to do that.
Anyone else? To go along with what Mr. Trump said, if the adults don't follow the guidelines, we will never have the students follow the guidelines. And that is going to be an issue that has to be, but we can't solve it. Everyone up together has to take personal responsibility. This information from the state, because we've received their information since March, I have verbal confidence in the state. This is something new, the way they are reporting it. I don't quite understand it. I don't know they've done it long enough to prove it's accurate. That's the reason we changed before, is that on short notice, they changed the way they were reporting this information. I've received emails, phone calls, and texts, and I know we all have different constituents, but I've heard from staff members, I've heard from parents, I've heard from this, and I've heard from administrators. 100% of the people I've heard don't want their kids back in the building. And that's not the reason I'm going to vote the way I think we have a good plan to work hard at it. The longer we wait, at some point in time, there's going to come a time we can't take bus drivers aid right now. They're working, we're finding stuff what we do. But if we start losing those folks too, we're going to be very going to do about that. But that's the reason I will support this tonight. And it's up to the board as a whole. And I'll call the question this tomorrow. Make them find what they think is best overall for the students of this county. One more time, everybody else.
Mayor, Dr. Jones is going to be sharing updated information with us on the 8th. We will be.
Yeah, we'll get another update on that.
Anyway, we can push this out to the agency if the dates come down, we get on, we think that's another week, 2 weeks on.
I think the only issue that you can always reverse it on the 8th if things change, but it needs to be notified first so they be prepared. That's what we talk about today.
My concern, Mr. Chairman, is that we're gonna say we're going to 14, then we're gonna push it out again, just like it's me. We keep giving dates and we keep losing the thing. I would rather us get to a place and say the trend is better now. We feel like it's much safer to get them in the building 2 weeks ago in the building.
And I'm just cautious that I'm not sure that will ever happen under current circumstances. With the state, with the state, with the way they've changed things since March, and the way we keep getting different signals. We should never have gone that in March.
Mr. Chairman, may I say one more thing?
Yes.
We need to really take, and look, I appreciate what everybody's done. Everybody has worked hard. Teachers have worked hard. Administrators have worked hard. And they deserve credit. But we are not taking this thing as serious, I think, as we need to. These numbers, I'm going to go on record. I could be wrong, but I'm going to go on record tonight and say to come to the middle to the latter part of September, we're going to see a spike that we haven't seen before. I just feel like that, adults are one thing, but when you start getting teenagers and you start getting college kids, and I'm not picking on those people, but they just don't have the, and maybe I shouldn't put it that way, I just don't think that they're going to social distance the way that they need to during this holiday time. And we're going to come back the latter part of September, and we're going to see a spike in cases. And what's going to happen is if we come back too early, and I know that the state health department is putting it on our back, saying, okay, I'm gonna leave it up to the localities, and we lose a teacher, or we lose a student, every lawyer in Virginia is gonna be parked out here wanting to sue us. Now, I know we may have some immunity there, but still, we're opening the door for something really big if we open this school too early and bring these people back in here. And I think that even September the 14th is way, way too early. I'm just hoping and asking you to please consider 6 weeks. Thank you.
Roll call.
Third. I too have some grave concerns about, starting up. As much as I would like to see students in school, being in the classroom, being an administrator, once upon a time, there's nothing more important than having that one-on-one, person-to-person contact. At the same time, with the numbers as they are, I feel like we've got to be very, very cautious. I've gone through the COVID virus. It's no fun. And I'd hate to see anybody come down with that. And like I said, with the numbers as they are, and I feel like we're not going to please everybody. Regardless of what decision we make, somebody's not going to be happy. But I would rather see us err on the side of caution than to go forward and then we run into something that we don't need. Thank you.
Yeah, anyone else? Roll call.
Mr. Burton?
Aye.
Ms. Crump?
No.
Mr. Dawes?
No, not yet, that I would like to revisit this next meeting. No.
Mr. Henderson?
No.
Mr. Mills? Mr. Moon?
No.
Ms. Redcliffe?
No.
Look at the name. We get a motion to adjourn.
I'll make that motion.
Mr. Matt, I guess clarification. So, the aid, I'll provide data to you. So, the plan would be that we continue on as we are remotely through the aid, with the 8% data to you. And then at that point, we'll make a determination, the board make a determination as to when the students would come back or in some way or another. Madam, we'll see the return, is that correct?
So we all voted no to this, and yet we're gonna say that that's what we're gonna do? Is that right?
Mr. Hannah, we voted, this is voted down. What we're saying is we will look at the data again on the 8th at our regular meeting.
I would agree with that.
Okay. All right.
Okay.
So, thank you.
We have a motion to adjourn.
I'll make that motion.
Ms. Crawford, second.
Roll call.
Mr. Burton?
Aye.
Ms. Crump?
Aye.
Mr. Dawes?
Aye.
Mr. Henderson?
All right.
Mr. Mills? Mr. Moon?
All right.